And to wrap up our international list of speakers, we have Elizabeth Homerosky from Canada. I hope I have it right this time. Who's going to talk to us on an outbreak of congenital chondrodystrophy of unknown origin.
Yes.
Thank you very much.
Yes, thank you for the introduction, and again to the organizing committee for selecting this case study to be presented. It's quite an interesting herd investigation that I'm going to share with you today. So hopefully, there we go. So this outbreak occurred at a commercial cow-calf operation in central Alberta. During the months of March through May, 32 heifers were calved out on that operation, and 29 gave birth to calves that appeared similar to this one. So these calves are abnormally small, about 20 to 40 kilos. They have, as you can see here, hyperextended joints, which contributes to an overall instability. As you would imagine, these calves are not presenting normally for parturition. The producer is assisting most of those dams, heifers, in calving, and he's also having to assist most of them with colostrum consumption. A large portion are either getting sick from secondary issues shortly after birth, or they're failing to thrive, and so a number of the calves are euthanized within a few weeks. And so when we summarize the clinical findings from these 29 calves, the primary lesion that we saw was these hyperextended joints. The majority of the calves also had signs of chondrodystrophy, or disproportionate dwarfism. There were 5 calves submitted for necropsy, and chondrodystrophy was actually confirmed by dividing the length of the metacarpus by the width. A ratio less than 4 would indicate that that calf had disproportionate dwarfism, whereas a ratio of greater than 4.5 would indicate that that calf was normal. The 5 calves that were submitted to the pathologist had ranges between 2.6 to 4.1. The pathologist also noted that there was thickened articular cartilage and a widened diaphysis. The more severely affected calves also had other clinical signs, such as the calf here in the lower right, superior brachygnathism. And so the most difficult part about an investigation such as this is it's quite devastating for the producer, but we're dealing with something where the insult likely occurred months ago. And so this complicates our investigation quite a bit. And so we're even more critical to this case is the history. These 32 heifers were exposed to a single 2-year-old Black Angus bull for about 60 days. They were on pasture until mid-November, at which time they were moved, and then the producer began the winter feeding program. And so their diet differed slightly from the mature cow herds. Both the heifers and the mature cows received chopped hay. The producer noted that some of that hay may have had mold present on the bottom end of those round bales. Both the heifers and the mature cows received loose mineral, and both of their water sources were from a well. The main difference in the diets were that the heifers received rolled barley as a supplement, whereas the cows received straw. Now, interestingly enough, all of the cows gave birth to normal appearing calves. And in fact, there was one heifer who was mistakenly sorted with the cows, wintered with the cows, and she gave birth to a normal calf. So I'd like to thank her for the foresight she demonstrated and the willingness to serve as a control in this case. And so at this point, because of the overall prevalence, we have a general idea of what's going on, but we want to rule out some very other differentials high on our list. The simplest thing that you can do in a herd outbreak, I think, is blame the bull, and so that's what we tried to do first. We tested the bull, 4 affected calves, and a couple of dams that gave birth to affected calves for the PRKG2 gene, which is the mutation associated with dwarfism in Angus cattle. They were all carrier status free. No evidence of toxic plants in the fields, particularly lupinous species. These do not cause signs completely similar to what we saw, but they do cause angular limb deformities. In terms of infectious agents, BVD, if you listened to the lectures a couple of days ago, they can manifest as just about anything very creative BVD is. And so those 5 calves that were affected all tested abnormal for BVD, or negative for BVD, because BVD has been known to also cause some deformities with the legs. And so that leaves us with a nutritional etiology. And so at this point, I want to share with you what's in the literature, because we're fairly certain of our diagnosis at this point. We think it's congenital chondrodystrophy of unknown origin. This has been known as numerous different syndromes over the year, which complicates review a little bit. It was first reported in the 1930s in the Sierra Nevadas. And it was thought that it was caused by those dams ingesting acorns. And so the calves that were affected were called acorn calves for many years. Since that time, various authors have renamed the syndrome either based on what they thought was the most clinically apparent or the most clinically significant. And a review published in 2010 suggested we adopt this name, congenital chondrodystrophy of unknown origin, or CCUO. This has been reported around the world: North America, Australia, New Zealand, South Africa, and quite a few countries in Europe as well. The interesting thing about all the suspected risk factors is that, for the most part, they're somehow nutritionally based, and it's more common that spring-born calves are affected. And we think the reason for this is because the critical time for growth plate formation, skeletal development, is 3 to 6 months. In the southern hemisphere, this would overlap with the typical drought period that Australia and New Zealand might experience. And it also overlaps with the overwinter feeding period in the northern hemisphere. And in fact, the majority of the cases, all the cases in Canada, the majority of cases in Europe, have been associated with feeding silage. I think because those cows are being housed, and so they're only eating what we're giving them. And so the underlying etiology in terms of these nutritional causes is thought to be due to a deficiency of manganese. So this is a critical trace element, and it's essential for cartilage formation, epiphyseal growth plate formation. Beef NRC recommendations would suggest 40 mg per kg on a dry matter basis for a gestating beef cow. However, there have been, this syndrome, very similar, has been induced experimentally by feeding diets less than 17 mg per kg on a dry matter basis. And so that resulting in a primary manganese deficiency. Now, there have been some natural outbreaks where it was documented that those cattle were receiving adequate amounts of manganese. And so several different authors have theorized that potentially there's a secondary manganese deficiency going on. There's a lot about, as we just heard, minerals and how important they are, how they interact, and potentially some other minerals, vitamins, or mycotoxins could decrease the bioavailability of the manganese in the diet. And so now I'll move back to our case in terms of trying to find an etiology. I performed mineral analysis on serum from 4 dams and liver from those 5 affected calves that were submitted to a pathologist. The laboratory reported that all of the manganese levels were within the normal range. However, again, this insult likely occurred months ago. In terms of the feed samples, this is also a really difficult part. The feed's been fed, it's gone. The producer was able to give us a small portion of hay that he thought to be of similar quality cutting to what he was feeding. That hay was analyzed for manganese and had a concentration of 13 mg per kg on a dry matter basis, and that's considerably low for hay. In terms of barley, we didn't have any samples, but cereal grains are among the feedstuffs that are the most consistent in their mineral analysis, and so I can extrapolate from the literature in ballpark that barley grain had about 18 mg per kg on a dry matter basis. And then based on what the producer said he was feeding in terms of mineral, he's putting out a 20 kilo bag every 1.5 weeks. If I assume equal consumption among the 32 heifers that were appropriately pastured together, and that there was zero wastage, the maximum amount they would have been consuming was 260 mg per head per day. Now, if I take that all back to a dry matter basis based on the producer's records for what he was feeding, that means we have a maximum intake per day of 25 mg per kg on a dry matter basis based on the fed diet. I don't know how much those cattle were getting from grazing. Now that was an exceptionally harsh winter. I think everybody lost a body condition score this winter in Canada. It was pretty rough, a lot of snow cover, and so he does not believe that those cattle were getting a lot extra from the pasture. 25 mg per kg is certainly below the NRC recommendations, but it's also quite a bit higher than those diets that were 17 mg per kg and induced these abnormalities. And so I'll review some key discussion points here from this case. Again, there were normal calves born to all of the cows and the calf that was born to the heifer, who sorted herself with the cow herd. I analyzed the producer's records in terms of calving date, the severity of signs, no appreciable trends or relationships there. Additionally, the 3 to 6 month, the high-risk period, overlaps with the mid-November pasture transition. And so this really complicates this investigation. Compared to previous outbreaks, it was similar in that it occurred among spring-born calves, and it's also more commonly reported among heifers instead of mature cows. The most unique thing about this case is that all the previous reports in Canada have been associated with feeding silage. And these heifers had no access to silage. And so we highly suspect a nutritional deficiency. We have a diagnosis, but we don't have an etiology. Potentially, that hay did have mold on it. Maybe there was a mycotoxin that decreased the bioavailability of that manganese. Maybe there was high iron, high calcium in the well water that affected the bioavailability. The other important thing to note is that the heifer diet did not equal the cow diet. And so potentially those cows were more efficient grazers. Maybe they grazed through the snow. And also they were fed straw. And contrary to what you might think, straw has a much higher manganese concentration than barley, actually about 28 mg per kg. And so maybe that was just enough to ensure that those cows did not have affected calves, as these heifers are obviously still growing at this stage. So I thought it would be interesting to give you a follow-up. Only 11 calves actually survived until weaning. Among those 11, 9 had appreciable residual abnormalities. This is the same calf here at 1 week and 5 months. The joint laxity, the hyperextended joints, resolves by about 2 weeks of age. However, severe chondrodystrophy that we can see in his herd. So here's the picture, the calf on the left here. You can see the dish space. This is quite a small calf. And the two pictures on the right with the two calves, it's the same pair. The larger calf is 1.5 months younger than the calf on the right. And so this was quite devastating for this producer. Probably one of the most obvious things, if you don't know the age of these calves, is the angular limb deformities. So we've got carpal valgus, carpal varus, also superior brachygnathism that's still apparent in those calves. So with that, I would like to thank the ranch owners, the referring veterinarian, Dr. Guichon, the faculty investigator, Dr. Eugene Jansen, the pathologist that we consulted with on this case, Dr. Legg, and my ABVP residency advisor for Dr. Edward Timsit for all of their help and assistance with this case. Be more than willing to take some questions, but I'm also equally interested in other people's experience with this syndrome and what thoughts you might have on an etiology. Thank you.
Thank you very much, Dr. Thank you, Dr. Homerosky. If we have any question, and I'll kick off with the first one. How did he do in 2015, the following year?
So no cases since then. So, he had grown home raised his own heifers for years and years and years. The bull that was used the previous year. Literally, he did not change anything except that he thought, man, it's a harsh winter. I'm going to give them more barley. So.
A question here.
Yes, ma'am.
Anne Rollin from France. So we had exactly the same case in Holstein herd, and so we made a pedigree analysis, and it was really no chance to be due to genetic in this herd, and he had 7 cases for just in heifers, also not in other cows. And so also we had manganese levels which were in the reference ranges. So exactly the same. Maybe the little bit difference is that the cows were not pastured in our case, and also for the clinical signs there were tachycardia and fatigability. I'm not sure that it's the right name in English. So.
Oh, okay. Thank you. Yeah,
okay.
Thank
so
you very much for
sharing.
sharing.
We are still making the investigation, but we not have also clue to know what was the etiology.
Yeah, very interesting. Thank you.
Any more questions? It's a condition we're very familiar with this side of the world, except that we associate it with silage feeding. Does John May want to make any comment?
Yeah. I suppose, as John said, most people in Europe, I think, have seen this condition, and manganese is the assumed etiology, but the unproven etiology. This adds to our information, I think, finding it under the conditions you found it. But I don't think it ultimately answers the question for the producer, particularly when I assume in this case they didn't do anything different the year before nor the year after, yet it didn't occur.
Yeah.
That's the conundrum.
Yeah.
I think we'll have to wrap it up there. We've gone over time. I thank Dr. Homerosky and all the speakers. Thank you very much.